Patty Stalker here from WestfordCAT, and I have with me Jeff Stevens, and he is Westford's health director. And we have been trying to check in mostly weekly to kind of keep an update on what's going on with the COVID-19 pandemic and also other information about health and safety in Westford. So how are you, Jeff?
Good today, Patty. How you doing?
I'm doing great, thank you. So let's touch a little bit on Thanksgiving and the expected uptick in number of cases. Actually, it seems like it's already begun. Yesterday, December 2nd, there were 4,613 new cases in Massachusetts. Is Westford seeing an effect on that?
So yes, that number that you saw of 4,600 cases was for a period of time more than 24 hours. However, regardless, that's still a fairly large uptick no matter what. Well, it's more than an uptick, it's a large increase. We are seeing more cases in Westford for sure. Yesterday we saw at least 14, it could have been 16. I can't remember exactly at this point because they came in pretty quickly, but the total number of active cases we have in town is 48 cases right now of people addressing COVID at their house.
Wow.
317 have recovered, and we've had a total of 380 in town to date with 15 known fatalities. Fortunately, we have not had a fatality in quite some time.
Great. Yeah, it does seem like the treatment is getting better, but as the hospital, they're understanding how to treat it better, but as the hospitals are getting full, and I know in some states their ICUs are just overrun. So people have to keep that in mind as the Christmas season and the holiday season is coming upon us. Do you have any advice?
Well, right now what we know is people have a lot to do. There are presents people have to buy, there are errands people have to run, and people are going to be very tempted to get into groups with friends and family, and we're clearly seeing that doing so is causing the numbers to rise. And there will be times where people are going to have to make a difficult decision to not see family and not be around friends in large groups, especially ones that are out of town and you haven't seen in a while and aren't part of your normal pod of people that you may typically associate with. And there's no doubt it's going to be tough. I know at my own Thanksgiving, at my house, it was my wife and my two kids. We did not have any other family members there. It was very quiet, very different for us. Fortunately, technology allowed us to Zoom meet my parents and my sisters and my in-laws, so we were able to do that. And we do know there's light at the end of the tunnel at some point. The problem is it's still a very long tunnel. We know that there's a vaccine out there. We know it's close to being released. We know the implementation plans are being created right now, but that still doesn't negate the fact that we're still dealing with a dangerous disease that is making people sick. And until we have the vaccine in hand and people are being vaccinated, we still have to be vigilant. And I think that's probably the most important message.
Yeah, I know people are getting tired. We're all getting tired. It's very difficult to have been, inside and away from people for, since March, but you're right, and we have to stick with it. You can't throw in the towel now. There is a light at the end of the tunnel. So, I think that's really good advice, Jeff. So go ahead. No, you.
So for the past 5 weeks, the state has been sending us our raw data for percent positivity in the amount of people that are tested with the amount of people that are positive in those tests. And we've seen a steady increase in that from week 1 through week 5. This last week, we actually saw that percent positivity level off at 3.28 for 2 weeks in a row. However, we won't know the effects of what Thanksgiving will do until we get next week's numbers. And that, I think, we'll see what that true change is. If it stays about the same, that would be great. If it goes lower, that would be great, but we won't know until we see it. Currently, Westford's still considered a low-risk community at this point, or lower risk community, I should say, at this point. And I'd like to hopefully be able to keep us there.
Yeah, I did notice last week that Chelmsford, Littleton, and Tingsboro were on the high risk list. So that's just something to keep in mind.
Right. We've been doing a great job in Westford overall. There have been some cases where we need to address larger gatherings, but hopefully those are to a minimum. And that's all we're asking people to do is just wear your mask, socially distance. And the message this time of year never changes: wash your hands.
Right? That's good advice anytime. So there's some new quarantine regulations that have come into play. Can you touch on that?
Sure. The CDC has come up with some new guidance. Many of you may have seen it on the news. And that guidance is reducing quarantine from 14 days to 10 days. And additionally, if you have a negative test, you may be released quarantine from 10 days to 7 days, provided that you are not and have not been symptomatic. The only caveat to that is while you might be released from quarantine, you still need to wear your mask and you need to self-monitor every day for at least 14 days. And if you do become sick or ill, you're going to need to contact your healthcare provider at that point.
Yeah, I know. Like my son, was home for Thanksgiving and then went back to school, and they're keeping every student in their room, and they all have their own rooms. This is Suffolk University. They've, I guess, rented out some hotels, like an actual whole hotel, so that every student, and they're only freshmen and sophomore on campus at Suffolk. Juniors and seniors have to live off campus, but the freshmen and sophomores are quarantining for 7 days, or it might be 10 days. They cannot leave their room. So food is brought to them. All the classes are virtual, and so I guess they're following the new CDC quarantine guideline as well.
So yeah, as this guidelines are rolled out, we've seen them for the first time yesterday, and as things change, we'll make sure we let the public know where appropriate. There are people that are following the previous guidelines. If we're able to contact them, we can potentially update them on the new guidance and build off of that. But every time we do that, it's more of a case-by-case basis.
Well, that's why I like doing these updates with you too, though, is we're getting the word out, and people who might not know what's going on, nationally and locally, can watch us and learn. So I really appreciate you doing these weekly updates. It's very informative.
Well, I'm glad I can help. And maybe the other most important message I can offer is if you don't feel well, get tested and stay home. We are seeing cases where people are not thinking their illness could be COVID related. They think, oh, it's just a cold, it's the winter, and they're still going into work. They're finding out that they are COVID positive after. So really, really be vigilant in the fact that if you don't feel well, please stay home. If you are symptomatic, if you've got the symptoms of new loss of taste and smell, headache is becoming a symptom, people that have the sniffles and the cough, abdominal pain is shown as a symptom. Nearly anything that you can associate with a cold or the flu is a co-symptom of COVID-19 at this point. So we really would recommend that if you have those symptoms, it's time to get a test and find out where you really stand.
Okay, great advice as usual, Jeff. Is there anything else you'd like to mention before we say goodbye?
I think that's good today for Patty. Thank you very much for having me on. And if anybody has questions, they can absolutely call us and let us know, and we can try to help with any questions they have.
Wonderful, Jeff. All right. Again, thanks for the time, and we'll check in next week.
Sounds good, Patty. Have a good day.
You too. Stay safe. For WestfordCAT, I'm Patty Stockman.